Kids Health Watch with Dr. Sang is sponsored by Sang Pediatrics.
I don't know if there's anything really that is normal. We can maybe do a segment on that coming up. What is normal? But we are talking about children's health. A local pediatrician, Dr. Nu Sang from Sang Pediatrics this morning. And I was thinking, our producer, Chris and I were talking about what's going on with our kids.
Okay.
Right?
Yeah.
And what do we want to talk to you about? And I'm thinking, well, we're starting to get into week 10 or so of the school year. And maybe students and families are noticing maybe the kids are having some trouble with homework, attention, getting involved. At what point do you look into it maybe being ADHD?
Oh, okay. So a lot of times people come into our clinics and they ask, does my kid have ADHD? And really it's all about how the children are behaving, not just at home, but at school. And it has to be consistent. Remember, ADHD, the last D is disorder. It is not controlled by the child. Some people think like the child is like, oh, they're just misbehaving and stuff like that. When you actually have the disorder and you're diagnosed with ADHD, or the child is diagnosed, really their brain cannot focus. And that's all it is. It's a lack of focus and leads to hyperactivity or inattention, or a combination of both.
Okay.
So I'm happy to come onto the program and talk about this.
Well, let's talk about the different kinds then, first off. So let's do predominantly inattentive type.
So inattentive, really, like they just can't focus, right? They can't do their homework. They can't sit down and read a book. And some parents are like, well, my kid can play video games. Well, that's just really like a very easy task for the brain to handle. But in order to complete complex tasks, or something a little bit more, takes more concentration, it's difficult for them to do so. So they forget details and they're not able to complete it. And they're easily distracted. And that's what inattention is.
And then you add the hyperactivity part. What's that?
So that's the part where the kid is running around the doctor's office and can't control themselves because their brain cannot focus. Their brain is kind of like is like all cranked up all the way to 11.
Wow.
Right? All the time. And so they're the kid who can't focus at all. And that's the one where the teachers are having troubles all the time because they can't sit still. They're impulsive and they're talking a lot and being disruptive.
So we may see these as obvious, but how do you diagnose it?
Right. So the parents usually come in, and we're very careful at Sang Pediatrics to not overdiagnose anybody for anything. It's like we don't want to throw pills at children. And so usually before 6 years old, when the parents come in, those children are pre-K and kindergarten. We don't want to jump into medication yet. We utilize, and again, since it's a disorder, it's going to be prevalent not just at home but at school. And so we want the parent and the teacher to give us information and data. We'll analyze it, and then we can make the diagnosis based on that.
When you talk about medications, what are some side effects? I had heard some people say that it makes that one of the reactions was.
Yeah, we don't do that. Okay, so a lot of misconceptions are that doctors are going to sedate my child, and the number one fear of parents when they come into our clinics is that I don't want to turn him into a zombie. And I'm like, I'm not going to do that. I'm just going to give him medicine at the lowest dose possible with the least amount of side effects to get the child to be able to focus. And that's all I'm trying to do. So most of the medications out there are safe. They've been around for decades. And we monitor for side effects, especially like I just put a kid on last week, and I have them come back every week, measure their blood pressure, measure their weights, and make sure that they're eating and sleeping, because sometimes these medications can cause decreased appetite, insomnia, and weight loss. So I monitor it, I make sure it's safe, I make sure we minimize the amount of side effects and maximize the benefit. And that dad loved it. because he said, she actually listens to me now.
Wow, so it
Yeah.
really worked that quickly.
Yeah, within,
Awesome.
and I gave the lowest dose. So.
Oh, thank you.
Yeah.
Well, a friend of mine at 40 got diagnosed
Right.
finally and got a medicine. She says, I can finally finish folding the laundry. I mean, just simple tasks sometimes.
Simple
but
tasks, that's right.
Thank you so much.
Thank you, Kim.
Really appreciate
Thanks
the
for having
time
me
on this.
Mm-hmm.
Now, this is Dr. Sang of Sang Pediatrics, and if you would like any more information or maybe watch the segment again, you can contact Dr. Sang at one of the 2 Sang Pediatrics locations in Fresno, or go to kmph.com, click the tab labeled Kids Health Watch from the Great Day drop-down menu.